that cancer will strike you if you have your father, mother, or sister, brother who has had that cancer.
Yeah.
And,
well, I want to say one last thing about that. My grandmother, the reason why my grandmother had cancer in the 60s, actually the year after I was born, and she at that time had very radical surgery, but she lived to 92 years old.
she had breast cancer.
She had colon cancer.
Oh, colon cancer.
Colon
Okay.
cancer,
Uh-huh.
and was a colon cancer survivor for over 45 years.
She caught it
How
early.
amazing.
Caught it early.
Well, at that time, you know, it wasn't quite early. It was, well, she was early, but she had kind of radical surgery in those days. They don't do as radical a surgery, but she survived, and that's
Lived
an
to tell the
amazing
story.
story. Yeah.
For great-grandchildren.
Saw 10 great-grandchildren that she never thought she would see.
Okay, enough for that. Do get your screening early for cancer, especially if you're over 50. Then you're in the jeopardy area, zone, I might say. If you're over 80, you'll probably outlive any cancer. It grows slowly in older people.
Well,
God help you, you know.
I don't know about that.
I'm not saying.
Ask your doctor and get your screenings as appropriate.
Yeah, gentlemen who get prostate cancer when they're 80, they just say, keep an eye on it. Don't worry about it.
I think it really depends on the type, you know.
Yeah, right.
It really depends on the
Right,
type.
you can have the very viral stuff. And of course, in the old days, they had some pretty serious treatment for breast cancer. They'd give you a double radical mastectomy, and that was a big deal. I mean, they took everything out. And
now they don't have to do such radical surgery, and they have better chemotherapy and radiation treatment. So
yeah, and they can also save enough of the breast so you still look normal, even though you've had a mastectomy. Okay, Mary Ann Spanos, she is our director of the Office of the Aging here in Chaut County, and I think we'll zero in on Chaut County a little bit here. Big county cuts coming. How's that going to affect you?
Well, at this point, cuts have been suggested to the Office for the Aging, but they've been voted down in committee. I don't know if on the floor of the legislature, I think it's the 26th, that the full legislature will be meeting to discuss the proposed budget by our county executive and the changes that have been proposed by the Audit and Control Committee. And so those will be debated. Our budget request for this year is $770,000 of local share to bring in $4.5 million of services for seniors.
It seems foolhardy not to go for it, right?
Well,
if you bring all this extra money in.
Yeah, unfortunately, unfortunately is out there when you're in a budget crunch is they look more closely at what we call non-mandated departments. But once you agree to accept the money, you have to provide certain services. So once you get any of that $4.5 million, we are required to provide certain things. And we have, at the Office for the Aging, our terrific staff, since I came on board in 2007, have constantly been doing things better, getting more efficient. We've employed technology to reduce, double work on people where we were, entering things on paper and then putting them in electronically. We've reduced our staff. We've reduced the local share. When I started, for every dollar that was spent on Office for the Aging, 28 cents of that was local money. So that means that that came from your property taxes and from the sales tax that we receive. So in 2012, our local share will be 17 cents on a dollar.
So you've cut that almost in half.
Right. So our return on investment is very, very high. We keep reducing the amount of local dollars needed to run our department, and we keep increasing the number of people served. In 2007, we served about 6,400 individuals that we could count by name, and this year we served almost 8,000. So I think we have jumped tremendously. And our new census data that's out there If you will recall, in the year 2000, our census for seniors was 28,400. We are now at 30,500, and the total population of the county has been reduced to 134,000. So that means seniors, all of you, are 23%, almost a quarter of Chautauqua County's population, are 60 and over.
Okay, that's one of the
pretty
highest in the
tremendous.
state, I think. If not the highest, it's very close to it.
Well, it's pretty high. I haven't looked at the other
Yeah.
county numbers to see if there are others with higher numbers, but the national average is 18%.
Yeah,
So we are certainly up there.
Almost double it, yeah. And
Yeah.
of course, many of these seniors are, at this point, they have no money, they have no real assets, and so they're on Medicaid as well as Medicare, and they want to they want to actually do away with both programs in the Congress. Medicare is going to be a voucher program where they're going to give you a voucher. You go to an insurance company, say, look, I'm 80, I need health insurance, and I've got $5,000 toward it, and they just laugh. You can hear them laughing as they usher you out the door. We don't want people your age, even though they'll be by law required to take you, probably, hopefully. Anyway.
Well, you know, that has been talked about, but I don't think that will pass.
I hope
but it is important that seniors, both at the local level and at the national level, make your voices known. They've done the analysis on, you know, giving seniors a stipend to buy their own insurance, and there's no way that they could buy anything close to what they're receiving under Medicare.
They're receiving quite a bit less because they took half, not million, billion, $500 billion out of Medicare last year. They cut it out. And it looks like they like to throw the seniors right under the bus, but I
hope that won't happen, because our senior population is the fastest growing population in our country. We really need to look at these programs and revamp them. As you and I have discussed, these programs are 45 years old or more. And they were developed in the 60s, and we've added regulation to them and not necessarily gone back and looked to see what is really working, what do we really need, what can we streamline to make the Medicare system, not just the coverage for the seniors, but the system itself more efficient. And I think we had to start somewhere. Maybe healthcare reform isn't the perfect solution, but I think it's the beginning. I don't know if you know this, but Medicare, one of the big drivers of costs are readmissions to the hospitals. And people say, well, you know, they're forcing us out within a few days. And so, you know, it's like a catch-22. You don't let people stay in the hospital, but you also, you know, get these readmissions. And every readmission to the hospital costs Medicare about $10,000. Well, they have decided on a new initiative called Care Transitions, and I'm very excited about this because it's going to link the Office for the Aging with all of our local hospitals. You know, often when hospitals and doctors' offices look at a client, a patient, they look at the medical sides of things. And as we all know, there are a lot of things outside of the medical side that make us successful, you know, after a hospitalization. Do we have support? Do we have family to help us out? Are we getting good nutrition? Do we understand and can we afford and get our medications? So this new Care Transitions, we are putting in an application along with 7 other counties in Western New York, and I am happy to really say that WCA Hospital, Brooks Hospital, Lakeshore, and Westfield have all signed on to be partners in this. What we will have are coaches. We will have people that are identified as being at risk for rehospitalization, and they're all older adults who, some of them have congestive heart failure, some have had pneumonia, some have had a heart attack or other chronic conditions. And so what will happen in this new coaching is once they're identified, when they get admitted to the hospital as being at risk, the coach will come and see them in the hospital and tell them, but after you get home, somebody is going to come to your home within a day or two and talk to you and make sure that you're doing okay. And at that home visit, the Office for the Aging or whoever the coach is will talk to them about their discharge instructions, make sure that they have their follow-up to the doctor, make sure that they understand their new medication regimen. But we also will look at them and see if, do they need transportation to get to that doctor's office visit? Do they need a linkage with some of our home services to help them out, whether it's short-term, just to get them better? Because, when you're released from the hospital, you're really not 100% anymore. They don't keep you that long.
And one of the things that you haven't mentioned is not all your hospital stay is not necessarily all driven by medical care either. It's financial. There's a thing called the DRG, which was instituted many years ago, and the government said, well, we're not going to pay you for the time you have a customer, a patient. We're going to just pay you a certain amount because we have this diagnostically related groups. So we have about 400 of them, meaning that if they have a kidney problem, we'll give you a flat amount of $12,000. Whether you keep them in there for a month, you got to pay it if it goes over the 12. If you keep them in there for one day, you keep the money. It's yours. So there is I'm not saying locally, but there is a procedure designed to get you out of the hospital as fast as possible, because the faster they get you out, the more money they make on the DRG.
Well,
and
I don't know that that's truly the scenario.
Well,
but
Mrs. Jones wakes up like you wake up.
It certainly is tied, the reimbursement and what is allowed. The insurance companies, whether it's Medicare or another one, do say how long they can keep you and when it's appropriate to discharge.
Especially if they can get you out faster, they make more money. But I got a phone call.
Okay.
Okay, let's take a phone call. You're on.
Good morning. I want to thank you for all the information you're sharing with us this morning.
Sure.
But this is very, very confusing, especially for someone that has some parents that are getting older. Where do we get more information on all this?
On insurance or on all of our programs?
Long-term care, what are the services available for our folks?
If you think you're being rushed out of the hospital, friend, there is a state operation called DRG, and you can say they're trying to get me out of here and I can barely walk. They're going to push me out on the lawn and say, keep in touch, Mrs. Jones, goodbye. They keep the change on the DRG. There's a number. Let me give them the number. 1-800-4-DRG. 1-800-4-DRG. Call this and they'll put a stop to throwing you out of the hospital immediately.
But I think what he's really asking for is what resources are available.
Right, at the hospital.
And I'm really glad, through anybody. Okay. We have a helpline called New York Connects. And New York Connects can tell you about all the services that are available in our county to assist anyone with a chronic condition. And that's from a child with disabilities or a parent taking care of a child, a disabled adult, or a senior. If you want to know what's available not only through our office or through the government, but also what's available in the community to help you be successful dealing with your chronic condition, whatever it is, you can call New York Connects. That number is 753-4582. You can also call toll-free from Jamestown at 661-7582, or from the Dunkirk-Fredonia area, 363-4582.
Okay, and I wanted to also
New York
put your
Connects.
number in there. They could catch you, 753-4471.
Right, 753-4471. If you call that number, and I think they could put it up on the screen for us. Our New York Connects operator sits right next to our operator in Mayville, so they'll just hand the phone over to New York Connects. And she'll listen. The neat thing about our New York Connects operator, her name is Nancy Papalea. She used to be the 211 operator for Chautauqua County. And she not only listens to what you're asking for, but also has a way of screening as you're having the conversation with her for other needs that you might not have thought of. You know, we often get people calling us for Meals on Wheels, and that's the central number now for all of Chautauqua County to get Meals on Wheels. And